13.43% of new grads fail the NCLEX exam. Hey everyone, what's up? Welcome back to my channel, Nurse Katherine here. In today's video, I will be giving you 5 tips on what you should know before you sit and take your NCLEX exam so you don't become a statistic like that 13.43% of new grads. We are going to jump right into today's video, but before we do that, please make sure you are subscribed to my channel, give this video a big thumbs up, and hit that little notification bell. Other than that, let's get started. I will be giving you 5 things that you need to know before you take your NCLEX exam. So let's start with number 1. Number 1 is that the NCLEX is considered a CAT exam. A CAT exam is a computerized adaptive testing exam, and this form of CAT testing has been used on the NCLEX since 1994. NCSBN has a great video on what CAT testing is and the explanation of CAT testing, but in short, it's different acuity level questions, let's say levels 1 to 10. Now let's say level 6 questions are deemed the passing rate. That's saying that you are competent in your knowledge of nursing, but then levels 1 to 5 are nursing questions but aren't really deemed quite competent to practice as a nurse. Now, that level right there, that level 6 question we're saying is the competent level, that's the line, and then questions 7 to 10 acuity wise are the harder questions. So levels 1 to 5 are easier, 6 to 10 are the harder questions. Now again, we have that competency line. So if you are answering enough questions above that line, you are going to pass your NCLEX. If you are answering questions correctly but are below that competency line, you may be getting them right, but you are not getting these ones right, you are not going to pass your NCLEX. Like I said, NCSBN has a wonderful video on what that means, and you can find that video link in the description below. And this point leads me on to my next point. Point number 2. There is a huge myth out there that if you finish your NCLEX in 75 questions or 60 questions, whatever it is now, that you passed your NCLEX exam. And if you had the full 265 questions, that you automatically fail. That is completely and totally false, and I know that from first-hand knowledge. I took my NCLEX back in 2016 and had all 265 questions. It took me 3.5 hours to take my NCLEX exam. And I know some new grads who have had 75 questions and still have failed, or the 65 questions and still have failed their NCLEX exam. Remember, NCLEX is all based on that CAT model. Now, moving away from the actual exam, let me give you my 3rd thing that I think you need to know before taking the NCLEX exam. And that would be that you cannot wear a sweatshirt, you cannot wear a hat, you cannot wear a scarf, you cannot have anything extra with you when you are in that testing room. They will make you lock up all of your belongings, cell phone, purse, everything. You cannot bring anything to write with into the exam room. It's simply what you have on your body. So make sure you dress comfortably, because you could be there for 3.5 hours like I was, and make sure you dress warm, because we all know those testing centers can be frigid. Now, talking about actually taking the exam, not the exam itself, but in the process of taking the exam, this leads me on to the 4th thing that I think you should know before taking your NCLEX exam. And that is that you can take breaks. On NCSBN, it states, you'll have up to 5 hours to complete the RN and PN exams, including the short tutorial and 2 optional breaks. The first 2 hours into testing, the second after 3.5 hours of testing. Take time to analyze each question carefully. Once you submit an answer, you cannot return to that question. I personally took breaks during my NCLEX exam. I believe I took 2 breaks during mine. I took a restroom break and then I took another break just to clear my mind. And boy, did that help so much. Sitting there for 3.5 hours can be rough, guys. That can be so hard. So you can take breaks, and I do suggest taking breaks during your NCLEX exam. Okay, and lastly, my 5th and final tip for you all to know before you take the NCLEX exam is to familiarize yourself with the exam. When something is brand new, it can be so overwhelming when you are going into it. But if you are already familiar with the NCLEX exam, it will make your experience that much better. I used NCLEX Mastery when preparing to take my NCLEX exam in 2016, and I still recommend using this resource. They have so much that can help you in nursing school and preparing for NCLEX. Also, when you are a new grad as well, and even a seasoned nurse. I highly suggest using this resource, and I might be a little bit biased because I used them and I passed my NCLEX exam, but I really do recommend using this resource. They are offering 10% off their subscription of their app and their website to my viewers, so if that is something that interests you, you can find that in the description below. There is a link directly to that. Now, I have heard of others using UWorld or ATI, but I personally used NCLEX Mastery. So everyone, those are my 5 tips on what I think you should know before you sit and take your NCLEX exam. If you have any questions, please comment down below. Other than that, that is it for today's video. Thank you for tuning in. Make sure you are subscribed, like this video, and hit that notification bell. I will see you in the next video because that is it for today. See ya, everyone.